Hi, my name is Debbie. This is Pippi the Poodle. She's going to be my patient. First thing we're going to do is we're going to show you how to do a muzzle with a leash. We're going to start to tie the leash, put it upside down, put it around the muzzle, the knot underneath the muzzle, make it snug, come behind the dog's ears, tie it in a bow, like so. That way we can, if we need to, quickly undo the muzzle and easily take it off the dog. And that's how you put a muzzle on using your leash. Okay, so Pippi has a wound up here on her leg. So I have my vet wrap, my roll of gauze, my cotton gauze, and my bandage scissors. So the first thing I do is I make sure that my piece of gauze is about the size of the wound, which would be right about so. Then I take my roll of gauze. I'm going to start down here by the toes, being sure to expose enough of the toe so I can check it for warmth. I'm going to start at the bottom and roll up towards the wound, making sure it's not too tight. Then I would cut my gauze right here, which I'm not going to, so I don't want to waste this piece of gauze. So then I would take my vet wrap and I would make sure I unroll it first so that it's not too tight. Two of the most common mistakes are making the bandage too tight and also forgetting to unroll your vet wrap and rolling it back up so that when you put it on the dog, it doesn't go on too tight. So I'm again going to start down at the bottom, right where I started my gauze. And I'm not going to pull it tight because it'll make it too tight and cut off the circulation. So I'm going to just gently roll my gauze, or cover my gauze with my vet wrap, making sure that I have it so that it's not too tight, and unwrapping it off the roll before I apply it around the wound. I would cut it here, cut, 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 cut. I would secure it. It's self-adhesive, so it will stay. Check for tightness, make sure it's not too tight and yet snug enough. And keep an eye on the toes, checking for warmth. And that's my leg wrap. Okay, so now I'm going to demonstrate how to find the femoral pulse. I'm going to go to the back leg. I'm going to use the bottom one, which is easier for most folks. Lay down, Mama Jess. I'm going to locate the long bone, which is the femoral bone, which is this bone right here. I'm going to go about a finger's length underneath where that bone is and locate my pulse. I'm going to time it for 15 seconds and then multiply times 4, which would give me my heart rate. So Mama Jess has a pulse rate of 90. Okay, Mama Jess, hold on. Good care. Now I'm going to show how to do CPR on Pippi the Poodle. I have already assessed that she is not breathing and does not have a pulse, so I need to initiate the CAB method of CPR, which is circulation, airway, and breathing. So the first thing I need to do is find my position, which I would do by bending the front leg, and where the elbow comes on the chest would be the apex of my chest. So if I have a dog that I can't bend the elbow, then I need to approximate that apex by looking at the deepest part of the chest. So once I find the apex of the chest, on this dog I'm going to use the two-handed procedure by interlocking my hands and having both hands over the apex, making sure I have enough leverage to perform my compressions. So my compressions will be approximately a third to half width of the chest, and I need to push hard and push fast, being that this size of dog would have a pulse rate of 100 to 150. So I will, if I see the dog crash, I can initiate the compressions up to 4 minutes, but then I need to start my cycles. My cycles would be 30 compressions to 2 breaths. So I'm going to demonstrate my compressions. I have found my apex, 2-hand compressions, third to half width, and hard and fast, making sure that the chest is able to totally recoil. After I have performed 30 compressions, I'm going to switch to the head of the dog to do airway breathing. I'm going to close the mouth, make sure the lips are sealed, place my mouth over his nose, and give 2 quick breaths. My breaths would be a 1 second, very quick, and enough breath to see the chest rise. And then I would continue on with my cycle of 30 compressions to 2 breaths. And that's the end.